my name is Brandy Arena, and I'm in health class. And in health class, you have to do a subject which we want to advocate, and I chose sexual activity. First, let me start off with the definition of sexual abstinence. Abstinence is a deliberate decision to avoid high-risk behaviors, including sexual activity. Abstinence is a form of contraception and is the only 100% sure way to eliminate risk associated with sexual activity. Contraception is forms of preventing pregnancy. These risks can include pregnancy, unplanned pregnancy, and STDs, or sexually transmitted diseases, which are infections spread from person to person who engage in sexual contact. STDs can also be referred to as a sexually transmitted infection, which are STIs. Examples of the STD are AIDS. AIDS are an acquired immune deficiency syndrome. History. People have been faced with epidemics, occurrences of diseases in which many people in the same place at the same time are affected. An estimated 65 million people in the U.S. are living with an incurable STD. Why? This could be contributed to the high-risk behaviors that many people participate in. High-risk behaviors include being sexually active with more than one partner, engaging in unprotected sex, selecting high-risk partners, using alcohol and other drugs. To reduce the risk of STDs, teens must understand the causes, the consequences, and prevention of major health risk behaviors, including the transmission of HIV and AIDS. Some people, including teens, are unaware of the consequences of STDs. Some STDs are incurable. The pathogens that cause these STDs cannot be eliminated from the body by medical treatment. AIDS, or HIV, for example, remain in the body for life. Some STDs cause cancer. The hepatitis B virus can cause cancer of the liver. The human papillomavirus, HPV, can cause cancer of the cervix. These STDs cannot be cured. Some STDs can cause complications that affect the ability to reproduce, and some STDs can be passed from an affected female to her child during, before, or after birth. These include the HPV, which is the most common STD in the U.S. Virus that can cause genital warts or an asymptomatic infection. CDC estimates that 50 to 75% of sexually active males and females acquire HPV infection at some times during their lives. A Pap test is a way of detecting an STI. Genital warts are pink or reddish warts with cauliflower-like tops that appear on the genitals, the vagina, or the cervix. Is an STD caused by the herpes simplex virus, HSV. There are two types of HSV. Type 1 usually causes cold sores, and Type 2 usually causes genital sores. However, both can affect the mouth and the genitals. Nationwide, about 20% of the total adolescent population is infected with the virus. Genital herpes is twice as common in adults from 20 to 29 years old as it was today, 20 years ago. Most individuals who have genital herpes are asymptomatic and are not aware that they are infected. Those who do show symptoms typically have blister-like sores in the genital area that occur periodically. It is not true that the virus can be spread only when blisters are present. The virus can be spread in the absence of symptoms. Diagnosis is made through laboratory tests on the fluid from the blisters. Medication can relieve the symptom but cannot cure it. Once contracted, the virus remains in the body for life. Syphilis is an STD that attacks many parts of the body and is caused by small bacterium called a Spriochet. Infection is a painless reddish sore called a chancre at the site of infection. The sore will heal on its own, but the infection is not treated. It spreads through the blood to other parts of the body. Eventually, the disease can cause damage to internal organs, including the heart, the liver, the nervous system, and kidneys. Transmitted from a pregnant female to her fetus. An infant infected with syphilis may have a damaged nervous system and can die from the effects. STDs are a serious thing, and they can cause serious complications. So that's why, if you don't think you're ready or you don't think you're mature enough, stick with abstinence. And if your partner truly loves you, they won't push you to do anything. They really love you, they won't pressure you to do anything either. If you're not comfortable doing anything yet, then don't. But if you feel that you're ready, use a contraception method. Use something to protect you. Be smart and protect yourself.